through PMS. So when we had our original talk back a month ago, if anyone was there, we did learn about managing training through the menstrual cycle as a whole. So we would have learned about that follicular phase, the beginning of our cycle, when it's kind of time to push and hit some PBs. Obviously, it's a bit different when we get to that time where we do start to see PMS symptoms. So we're in that luteal phase. This is your time to recover and take it a little bit easier. So when we're training in our follicular phase and we're feeling good, we're doing that strength training in the first week, perhaps some hypertrophy in week 2. And then as we finish that first phase and we're getting into the point past ovulation, when we start to feel some of those symptoms, we want to start winding our training down, okay? This is not the time to be pushing hard, trying to hit PBs, and trying to do all the crazy intensity. This is a time to love your body and feel good, and focus on recovery. So main things we want to look at: low volume and intensity. So we don't want to be working to that kind of 90% capacity. We don't want to be absolutely red in the face, sweating buckets. We want to keep that intensity lower. This might be a good time to do lots of long walks, maybe an easy jog. We could keep that impact down, do lots of cycling, anything that you just enjoy. This is a really good time to do those things that maybe aren't on your training program that you just want to do. I mean, for example, like sometimes I love just going to a gym, jumping on the cross trainer or the stationary bike and just taking it easy and listening to a podcast. This is the time to do that, because obviously if we're exercising at intensity, we're going to make ourselves feel worse. If you're feeling bloated, you've got back pain, we don't want to be making ourselves feel worse by lifting heavy weights and training at that super high intensity. That also means in terms of volume as well, whereas in your normal program, you might have kind of big chunks of work, so maybe 4 to 5 sets of like 12 reps plus. We want to keep those sets lower. So we're looking at sets of maybe 3 sets with 8 to 10 reps at an easy, lighter weight as well. So that's something to bear in mind. Think about the total volume of all the reps and all the work you're doing. Instead of double training, keep it down to 1 session a day, or maybe 1 session and a stretch or something like that. This is a good time, as we discussed in the previous one, it's a good time to focus on kind of technical movement and light skill. So maybe trying something at low intensity that you want to kind of master. So this could be some very light gymnastics work, or something a little bit more technical that you wouldn't normally have the time to do, or you might be working at too much of an intensity to do. So yeah, low intensity endurance is absolutely spot on. So like we spoke about, that long cycle ride, a long easy jog, swimming is excellent as well. Any kind of aerobic work where we're working at 70%, using that energy system where we're not needing to push at intensity. Good time to use maybe bands and body weight stuff. So if you have bands and you want to do glute activation, hamstring work, body weight exercises, push-ups, pull-ups, this is a great time to do body weight things, especially like core strengthening exercise, Pilates. So core, Pilates and yoga is great as well. If you are on a training schedule that requires quite a lot of intensity in certain times, this might be a good time to schedule your deload week. So obviously we've looked at training around the menstrual cycle as a whole. If you are able to have that conversation with either yourself or maybe your coach, this might be the time. And if you track your cycle, this might be the time to put that deload week in on purpose, so that you're working at a lighter intensity and you're giving yourself that recovery, and you're giving yourself a break as well. And don't be afraid to not even have a deload week. Like if you're working at intensity at certain points in your cycle, and there's weeks, maybe a week in that point where you need to take the intensity down, don't feel guilty for enjoying a little bit of less volume. I think we put a lot of pressure on ourselves, and we don't need to always be putting pressure on ourselves. We can't go full send all the time. So it's really important to take this time when you might be feeling a little bit rubbish might be a bit bloated, then just take it easier. So talking about when we have our symptoms, they could occur anywhere in kind of the first week of the luteal phase onwards until menstruation. So this would be after ovulation. So it's really important to take that overall big picture approach of training throughout your cycle. Like I just spoke about, having that deload week, having that time where you want to hit your PBs, and looking at it as a whole and thinking, where am I going to work hard and where am I going to ease off? Because it's so important. It's very important also to remember you are an individual. You are going to feel different to another woman. You might even find that during this time when you have your symptoms, you might feel better than other people. So you might be able to do a little bit more, but it's very important to make a note of how you feel and work with that. There's no point pushing yourself when you're not feeling it. So in order to help those symptoms with exercise, one of the big things that's going to help is consistency across the cycle and obviously other cycles to come. So it's something like that you need to learn in order, if you don't track already or you started tracking, it's learning your body and getting consistency across. So if you're already in a really good place with your training, then you might find that you're already aware of when to push and when to not push. But starting a good pattern and tracking everything consistently, if you can continue to do that for a few cycles, you might actually find that your PMS might get less because we are managing it correctly in terms of the overall cycle as well. So if you follow me on Instagram or any of my blogs, you'll know that I always go on about studies around women and exercise and how there aren't enough of them. So I have pulled in a couple of studies that are going to kind of help support why we should be doing some of that lower intensity exercise around our PMS symptoms. So one study in 2013, they took non-athletes. It doesn't say if they're recreational, just non-athletes, so it's general population. They went from not really any training to over 8 weeks of aerobic exercise with 3 sessions a week for 30 minutes. Their PMS symptoms decreased by 60%. So that's only 2 cycles of gradually building in that exercise, and they found their PMS went down. And 60% is a lot over 2 cycles. Think if you're not a regular exerciser right now and you suffer with that PMS really bad, it might be a good time to bring in some low intensity work in order to decrease your symptoms a little bit. Another study, we had a look at swimming, and they found that they saw the same effect of this decreased PMS symptoms with regular swimming sessions of 30 minutes. So these aerobic exercise sessions that we're talking about is that low impact, maybe low intensity exercise, so stationary bike, jogging lightly. Swimming is excellent because it is such low impact on your joints. There's no impact, and it just, it's one of the best things you can do. Less injury risk as well, especially as at a time, we might be more at risk of inflammation, we might be more at risk of injury, and swimming is low impact and less injury. Obviously, I know right now it's quite difficult to be going swimming, but this is something we can bear in mind for the next few months. In the summer especially, it's going to be such a big help. And as already spoken about, using the stationary bike or cycling as well. So another thing we could have a look at is the hormones, which are, the culprits for some of these PMS symptoms we get. So when we are at that point in our menstrual cycle, we are producing prolactin, which is produced in the breasts. And this is what causes tenderness and swelling, and it's higher at this point. So we found in one study in 1998 that the levels of this hormone can actually be reduced with that aerobic exercise. Translated normally, this means that if we're doing that low intensity, steady state aerobic exercise, you are going to have that tenderness in your breast is going to go down because it's going to help reduce that hormone. Other hormones, we look at prostaglandin, which is something that aids inflammation. So what we found is this inflammation is one of the causes, obviously, of getting like lower back and joint pain where you feel stiff and sore in that PMS. Again, aerobic exercise, this has helped aid this, and we've actually seen less lower back pain due to that aerobic exercise. Another hormone involved in water retention, aldosterone, leads to bloating, and physical activity is going to help regulate the reabsorption of water in relation to that hormone. So another really good reason to start with that aerobic exercise, and that's going to lead to less bloating overall. So obviously we don't want to be reabsorbing too much water because this is going to make us bloated. And so if we're exercising lightly, it's going to help to regulate that, make it a little bit more manageable overall. So to wrap everything up on the training side, consistency over time is going to be much better in terms of helping us feel better with our symptoms and manage our symptoms. So a consistent exercise regime over a long period of time. The science supports that low intensity and aerobic activity. So there's no reason not to do it. And if you're not already a recreational exerciser, then this is a good time to get into it because it's going to help your symptoms become more manageable. You're going to feel worse not doing anything. If you are inactive, sedentary, not doing any exercise whatsoever, you are going to suffer with worse PMS symptoms. Most likely, obviously, it's individual, but the studies seem to show that light exercise is going to help a huge amount. But make sure that you aren't going crazy and you decide to go and run a marathon or something because you think aerobic exercise is great. Low impact, low effort, and make sure we're not at risk of injury, okay? Okay, so any questions, you can pop them in the chat to us. And yeah, this is a good time for questions, I think.